Hi, this is Justin in partnership with Rolling Out Health IQ, and I'm here with Dr. Melvin Echols, where we'll talk about some of the most important things that come to mind and advice on how to have a healthier heart and how to manage your heart in today's age. Dr. Echols, thank you so much for joining us today.
Good morning. Thank you so much for having me.
So, question for you. Understanding heart disease, understanding the Black community. What are some of the most common cardiovascular diseases affecting the African American community, and just why are we at higher risk?
Hmm. How much time you got? um, I think one of the biggest factors, and actually this is one of the most modifiable risk factors that actually affects African American community here, is high blood pressure, hypertension. And so we do know that 1 out of 4 people in sort of across the globe and in the US will actually have hypertension. But what we don't know is that 1 out of every 2 African Americans will actually have hypertension. And there's a large percentage of people who actually don't know that. So there are several sort of nuances to this, right? There's the space where awareness is key in terms of knowing your numbers, knowing what a high blood pressure is, and knowing why it's important to bring it down. Then there is also the space of which I feel, um, the medical community has not helped with, but that's the clinical inertia of treating blood pressure. And we, I've treated thousands of patients, and I'm very much aware of how it sort of comes across when you have either a man or a woman who is, doing their thing, busy with work, taking care of family, and all of a sudden you're telling them that they have to stop and take 2 blood pressure medicines that might make them run to the bathroom or have other things go on as far as men are concerned. But you've got to be able to talk through those things. You've got to be able to make sure that they understand, look, if something happens to me, can I talk about it? And will you help me? So there's multiple things. Like I said, there's the awareness, the education in the community. There's the insight in terms of really understanding why it's so important to treat blood pressure problems, which happens to be the number one risk factor that kills people globally for cardiovascular disease. And then there's the talking and the patient trust with the clinician. So I think those 3 things could be a little bit better.
Talk about high blood pressure as the silent killer, right? Folks have no idea until it's an issue, right? And
Yeah.
what I think someone said, really don't have an issue until you have a health issue. You know what I mean? So quickly, what are some warning signs, early warning signs of heart disease that people often overlook? And if you could, if you do get distress and systemic racism, could you just at least make sure that folks are aware that these things are real, right?
Mhm. Yeah, yeah. No, I completely agree. So when you talk about acute signs and symptoms, let's take it to the actual emergent issues of a heart attack or what we consider acute heart failure event or a stroke or a abnormal rhythm problem. So those 4 things are the main things that sort of drive people to the emergency room in the middle of the night whenever they don't really understand what's going on. And so they all have very acute signs in terms of whether that be just all of a sudden shortness of breath, which can be anything. So this is where I try to make sure people understand that if you've never had a history of asthma or anything like that, and all of a sudden you're sitting up in the middle of the night because you can't breathe, because if you lay down, that's not your normal. So instead of doing that for 2 or 3 months and then finally until you can't take it anymore, the EMS is coming to pull you out of your house, understand like what's really going on here? What can I do about it? I think African American people have just been so traumatized in America for so long for medical things, whether that's access, whether that's judgment, whether that's implicit biases, and it has stunned people for, I think, knowing how to ask and what to ask, and even feeling comfortable asking questions. You as a patient have the right to know about your body. And so if whoever is treating you doesn't feel like it's worth taking time to talk about that to you, I think you have some decisions to make.
So then to that point, decisions, right? Lifestyle changes, right? We talk about access. What are the best lifestyle changes we can make to lower our risk of heart disease? Specifically with diet, and what role does the diet play with heart health? What foods should we prioritize? Let's start there.
Yeah. So the evidence will say right now, the best diet that uh, seems to sort of be beneficial for heart disease is a plant-based diet with low sort of saturated and kind of monosaturated fats. But what I will say is that even though that may be the case, there are millions of people in America that have grown up eating particular ways because of culture and because of unity. And a lot of times that's what has, brought people together. So it's really hard to kind of, walk into a space and say, oh, this is what you should stop doing and stop doing it. I don't think I could do that. So I think it's about moderation and understanding that as you change your behavior, you understand you make small changes. And over time, as you gradually kind of build up the bigger changes, this ultimately makes a bigger impact. So that number one. Number two, everything can be reduced. When you sit down and you eat, I grew up in a rural, place where poverty was, my mom raised us off of $10,000 a year, three boys and her. And so you did not want to waste meals. And so that mentality of cleaning your plate and not, wasting food, that source of scarcity is still in a lot of people today. And so I think that we have to understand that there are a lot of implicit things within ourselves that we do and we don't even know why we do them, but we just have to take time and just sort of make small changes over time.
Well, then to that point, physical activity. I myself have been, playing with resting heart rate, walking for an hour a day, and have noticed not only my weight go down, but the numbers have gone down. I'm a use this thing quite a bit. And I've been able to see massive changes in my heart health and how I feel. But I mean, I know that's my experience. What are your thoughts on the connection with physical activity and heart health and how can people incorporate movement into their daily lives to benefit and increase the quality and the health of their heart?
So move, move. That's like that's what we know. AHA will say 150 minutes of exercise over the sort of course of the week. It doesn't necessarily have to be in big 30-minute chunks. It can be 10 minutes plus whatever throughout the day, but move. My granddad passed at 98 and was chopping wood the winter before he passed because he was always moving. You know, we don't live as long these days, primarily because of our sedentary sort of lifestyles. And so, even steps, if you're in a sedentary job and you're not getting steps, increasing your steps, a couple thousand, just if you're only getting 2,000 a day, just starting there, small changes make huge differences. So, move. I'm not going to tell you what to do. I'm not going to tell you yoga or any of that. Do what you feel, and if and just keep doing it. So, and I'm so glad that you've actually been able to see that connection to the physical activity and actually the numbers. Um, I, I I think we need to encourage and empower more people to sort of associate those things and the way you feel.
Yeah, the I think using technology as a pull through and knowing that, yeah, like heart health or high blood pressure is a silent killer, but with technology, you're able to measure. It's almost like a second bank account. It's like a heart bank account, right? And it's like,
Yeah. I mean, we get, technology is great, but after you've had that Apple, whatever watch for 3 or 4 months, and the new version comes out, or it starts, irritating your arm. I mean, there are
Uh,
so there's a lot of issue with adherence and just kind of keeping that going. We've actually done studies with this. What I will tell you is find a habit of sort of attack in terms of like smart goals or sort of plan, and then just try to kind of make those incremental changes and meet those goals, and then make more goals over time. You don't necessarily need to do all things at once.
that's real. Yeah, 100%, 100%. And then sleep, the next one, right? How important is sleep, and how is it connected to heart health? And what happens when you don't get enough rest?
So it actually can be a very bad thing. So I don't know if you're aware or not, but the AHA, American Heart Association, has what was once Life Simple 7, which were a measure of 7 different things that if you actually monitored or changed, increase the likelihood that you would reduce, your risk of heart problems. The last one that was just recently added a couple of years ago is Life Simple 8 now, is sleep. So we know for people who don't get enough sleep, it actually increases your risk for problems, heart disease, CVD, heart mortality, and then also other things like arrhythmia or heart abnormality problems. So you definitely want to try your best to have good sleep. The first thing that I will hear whenever I tell people that is I don't get any sleep. And so you have to, like, again, it's about the sleep hygiene. You have to look through your day. Are you taking naps during the day? Are you, drinking alcohol right before you go to bed? Are you having a heavy meal before are there things that are causing your sleep to be disrupted that you need to work on? Really, it's about being very in tune to like your body. So yeah.
So when we start thinking about heart health in Black families, what are your thoughts on how Black families can incorporate heart health discussions in their daily lives, especially when it comes to generational health issues? You see a grandma or you see a loved one go through a heart issue. As a young person, you get scared. But I mean, I think it could be an opportunity to take the reins and really promote and try to reverse that generational trauma and fix it. What are your thoughts on that and healthy heart discussions?
Well, I definitely think it can happen. And I definitely think it's possible. My granddad that I spoke of, he actually developed diabetes later in life. Now, granted, he was born in 1899, my granddaddy. Um, but he developed later in life, and my um, aunts and uncles, they realized, oh, wait, it's because of the way we've been eating all this long time. And so I remember them having a conversation with my grandmother. Who actually, initially felt a little bit hurt about it because, again, when you're telling someone who has lived their life trying to make people happy on the means, little means that they can, whatever they have, they want to make sure that people are satisfied. So whether that's in the Great Depression or whether that's a Sunday dinner. And so she, slowly understood that less salt and less, lard and those things actually could make a difference. And my granddad was on insulin at one point, lost weight, lost about 20 pounds, got off of insulin at like 80 something years old. So that was another defining moment. So it doesn't have to always be about fear. It can be about seeing the change and seeing how it happens. And I know for a lot of families that the mother is the helm of health changes. It shouldn't be that way. Everything should not be on Black women for their families, but I will say that they have great influence and great impact. And so, getting stakeholders like the moms in the family actually definitely can do some great things.
And so to just at a very high level, what is a single message that you would like to share with Black men and women and just people of color about taking control of their heart health?
You don't know what you don't know. So if you do not know what your blood pressure is, if you do not know what your blood sugar is, if you do not know what your cholesterol is, go get it checked. Know your numbers, know what they mean, because then you can be empowered to change them. Do not be afraid of preventive care. preventive care can stop a lot of those major heart problems that we see, that I take care of so much that I wish, we had better access to preventive measures. And then community, please seek good sources of information. So in this era with technology, misinformation and disinformation in many of the vulnerable communities is one of the primary targets for disaster and disparities and everything else. So in your community, vet the source of information that is coming to you and understand how to find quality information if something sounds a little wonky.
So to that point, quickly, what are some trusted resources, programs
The
that you
American
recommend?
Cardiology. So the American College of Cardiology, as well as the American Heart Association, are two of the main sort of heart associations here. I'm the Chief Health Advancement Officer for ACC. But those two are really sort of guarded by evidence. We put out guidelines in different conditions that help people follow the evidence. So if things are going to be done right and done in a sort of optimal way, that is where people get the evidence from. So that's one of the reasons. But well, I'll leave it at that. Hopefully there'll be other sources in the future.
100%. Dr. Echols, thank you so much for your time, information, and healing and stewardship and just being a leader in the heart health community and just the overall medical community. Really appreciate your time. Thank you for everything.
No problem. Thank you for having me.